Hello and welcome to ATHT 4900, Instrument Assisted Soft Tissue Mobilization and Athletic Training, known to most of you as the Graston course. Before we get started into the course, it's important that we understand that even though this is a certification course affiliated with the Graston technique, we do offer this within a formal structure of a Graston University course. So in doing so, we want to go ahead and go through the parameters of the syllabus and what the expectations of the course are going to be. So we'll take this moment to do that. We will be meeting in the athletic training room from 9 to 11:30 a.m. As usual, you can contact me on my cell phone if you have any questions, or grab me in my office in 214 Zimmerman. And the official office hours for the winter term are going to be from 8 o'clock to 9 o'clock on Monday, Wednesday. You can catch me beyond those hours on many of the days, but those are the official ones that I'll denote to my office hours for this semester. Just a brief description of the course. Again, this is affiliated with Graston and the Graston technique. It's an endorsement class for students interested in pursuing the certification. We'll do no less than 12 hours of hands-on in this course. That's our minimum requirement. However, we'll probably be doing anywhere from 14 to 16. We're going to do a little bit, a few extra things that are associated after the Module 1 training. Okay, we'll be going over basically the introduction of what instrument-assisted soft tissue mobilization is, Graston technique theory, the basic instrumentation for both upper and lower extremities. So at the end of this, you'll receive an endorsement or a certificate of completion. Once you have officially completed your BOC certification, you then can contact Graston to receive your official certification form or slip or plaque to denote that you have completed all the requirements. And then you, at that point in time, when you move on to get your first job, can work out building an articulation agreement with Graston Technique to provide Graston within your particular facility. Again, all of you are seniors in the major and in the last semester of your undergraduate education. There is a required text for this. It's the GT manual. There's also a PowerPoint associated with that. Each one of you received an invitation to a Dropbox account labeled Graston, and within that you'll find 3 documents. And again, of specific note, you want to note the GT manual because there is an assignment for the first day, which is to read sections 1 through 4. The course objectives, much like the description, we want to describe the indications and contraindications of Graston technique and soft tissue mobilization. We'll demonstrate the GT instrument handholds and the different strokes. We'll also talk about the treatment methodology and the parameters associated with this modality. We'll talk about the physiological responses to the treatment. We're going to do this and practice and demonstrate this on different upper and lower extremity regions of the body. And then lastly, we're going to identify, gather, and describe current research and literature for instrument-assisted soft tissue mobilization efficacy for use on patients. And that's going to be a big part of your final paper or the projects that you'll work on throughout the class. Let's skip on down here. Our course evaluations, you are going to be evaluated on 3 primary areas, one of which is skill acquisition or attendance. Please note here that you lose roughly half your points for every absence that you have. So you want to make sure that you're being proactive, and if you have to miss a class for any particular reason, that you're communicating with me and letting me know why so we can make appropriate arrangements. But it is important to note that you are required to attend all of the the sessions, and you're only allowed 1 absence. Second absence will result in you cannot complete the certification process, and you would have to find an opportunity outside of this course to obtain your Graston Module 1 training. There will be a handful of assignments throughout the semester. You can find those in my Graceland. They total roughly 95 points, and as you can see here, that breaks everything up into about thirds. A third of it's based on your skill acquisition or the practicing the attendance for each one of the days of the workshop. The assignments, again, there's about a handful of those that are worth 95 points, or roughly a third. And the last thing is the final paper. So each one of those assignments culminates in the final paper, or leads up to the final paper. Because a big part of this is not only do I want you to understand how and why we use Graston technique, but to really fully understand the available resources and research out there to utilize this on patients, particularly in areas of either your own interest or your own expertise, whether that be for improved patient care or that for further research and graduate study or something like that. Okay, learning over time. There's not a tremendous amount of reading. As I said, you'll be going through the manual. You probably want to review your notes and their PowerPoints as we go through, but you might expect upwards of 30 to 60 minutes about twice a week, depending upon, again, how many research articles you find or utilize for your paper. There are a lot of labs. They're going to take over 50 minutes each, and again, you can expect upwards of 12 hours of contact for completion of this workshop. Again, I want to review the attendance policy because this is a big deal. Okay, any unexcused absence, okay, or tardy that coincides with the GT skills and competencies, they're not intended to be made up. Again, these are the unexcused absences. A student is only permitted to have one excused absence, okay, or unexcused absence for that matter. Any student that does not complete every skill is not eligible for GT certification. So, again, make sure you're showing up, but you can still receive a grade for the course. And last but not least, I want to note that, again, 2 tardies is equivalent to 1 excused absence. Classes from 9 to 11:30. So set your alarm early if you need to. Buddy up, pair up, whatever it is. Make sure that you and your partner are getting to class on time. I shouldn't even have to explain academic integrity. I think you all understand this. You are expected to use your own work. You're going to follow the academic dishonesty policy as it relates to Graston University. Failure to do so will result in an automatic F on that particular assignment, and you will be reported to the Vice President for Academic Affairs and the Dean should we have any issues, but I don't expect any of these from any of you. And again, remember, make sure you're citing all your sources. Our students with disabilities, make sure again that you're communicating with me and letting me know if you have any special requests or special needs throughout this semester. This is a laboratory course. That means we'll have to be wearing laboratory attire. We actually are going to be applying the treatments for any reasons. For example, when we go over the absolute and relative contraindications for Graston use, if you fall into any one of those categories, make sure you're communicating those with both myself and your partner, and we'll make sure that we make the appropriate accommodations so as we don't cause any problems or any injuries or exacerbate any existing conditions as a direct result of our practicing or use of the instruments. So please let us know if there's anything beyond that in terms of academic disabilities or anything like that. Again, and you're on an IEP of some sort, make sure you request those accommodations through Susan Knotts and our Director of Student Disability Services. I have provided just a rough schedule here. I want you to see again, we have our weeks denoted here on the left hand side along with their corresponding days: M for Monday, T for Tuesday, W for Wednesday, R for Thursday, and F for Friday. Here is our general topics of discussion. I do want to note that sometimes we may either get ahead or behind on certain material. It just depends on your level of comprehension and understanding of said anatomy and on the actual strokes and implementation of the instruments. So this is just a rough idea of what we might be going over. On the flip side, the reading and assignments, these are set, and you'll also note that in my Graceland you have specific due dates and time. So For example, this Monday and Tuesday we will be completing the predominant part of the manual, reading sections 1 through 4, 5 through 8, and then for each one of those I want you to take notes, and I'll be checking those notes in class. But this is, so the readings and assignments, this is exactly what we'll be doing in relation to how these are written up here in the modules. So use this as a guide along with your My Graceland. And again, our topics here are somewhat loose and dependent upon how far we get along, but we will have a total of a minimum of 12 contact hours. Last but not least, again, I've mentioned this one other time, please wear appropriate clothing for lab every day. This includes shorts and a t-shirt. Okay, for our ladies there, we will be going to the skin, we will be doing upper extremity, so we ask that you wear a sports bra for those days. We will utilize appropriate screens, drapes, and things of that, and towels and things of that nature, so that we can protect you all and be discreet as possible. We want to be appropriate as possible, but there are times when we're going to have to access large surface area anatomies, and it can be or feel a little embarrassing at times. But again, remember, we'll pull the screens, we'll drape appropriately, and make sure that we protect your confidence in that, no different than if you were a patient. But please dress appropriate for every day. The only time that's really an exception is on the first couple days of class. We'll be doing predominantly the background introduction components of the class. We may need to have access to a thigh or a calf or something of that nature as we just kind of introduce just real basically a couple of the strokes. But other than that, the rest of the days, Wednesday on, after the first week, we'll want you to make sure you're always dressed in appropriate lab attire. So again, thank you for your time. That should conclude the review of the syllabus. If you have any questions beyond what's covered in this syllabus review, always feel free to send me an email or ask me. I'm sure if you have a question, more than one person has the same question in class, and I'll be sure to answer that to the best of my ability.